talk about vital signs. And by vital signs, I mean the patient's blood pressure, pulse, respirations, apical pulse, and their temperature. And that's something you'll be collecting on your patients quite frequently. And today we're going to discuss all but the temperatures, really, because I don't have a thermometer, and each facility uses different kinds, whether it be a tympanic through the ear or a temporal that scans the temporal artery, or your oral thermometers, your rectal thermometers, or your axillary. You need to read about those in your book and become familiar with them. With the blood pressure, each of you should have a blood pressure cuff with a sphygmomanometer. And I posted videos online on D2L off of YouTube that allowed you to hear the carotid cough sounds and shows you the dial to learn how to hear and how to record it properly. So be sure that you review that. It's really good videos, and do the exercises, because that's something that's hard to teach here, and that allows you to hear it. Practice on your family members and get familiar with how to use the cuff. Now, when you're doing a blood pressure, ideally you want the patient to be sitting in a seated position with their legs uncrossed, with their arm at the level of the heart. Okay? Ideally. Now, of course, Miss Smith here is not able to do that, so we're going to have her just sitting in the bed and doing hers. Again, the ideal place, sitting in a chair, legs uncrossed, arm at heart level. So let's look at our sphygmomanometer and our cuff. This comes on and off. Now, a lot of y'all may be very familiar with these, and some of you may be spoiled by the machines. I will tell you, if you're going to call a physician with a blood pressure reading, you need to have done it with one of these with your ears. Those machines can be wrong, and you don't want to take the chance of the doctor changing someone's cardiac medications because the machine's wrong. So be sure that you listen with your ears. And if you're not sure of what you're hearing, get someone else to double check it with you. Because again, you don't want the doctor to increase someone's medicine or reduce someone's medicine based on your error or based on that machine's error. So on your cuff, you've got to be sure you've got the right size. The bladder of the cuff, or the part that blows up, needs to go 2/3 away around the arm. So if you've got someone with large arms, of course this isn't going to fit. This is your average adults. So do you need a bariatric cuff? Do you need a pediatric cuff if someone has very small upper arms? Ideally, we do these on our brachial artery. And your brachial artery, if you turn your arms out, it's going to be to the inside. It's going to be up above your pinky to the inside. Usually right up or right in the bend of your arm. So be practicing on your family members, finding the different pulse sites. But your brachial artery is up from your pinky. You can feel it. Sometimes it's right up above it. And depending on your cuff and what arm you're using, you want to be sure that this is lined up. That arrow has to be on right above that artery, about 2 finger breadths above that artery. So on me, on my right arm, I would want to place it about right there. Okay? Now on our mannequin, of course, I can't get a reading on my mannequin. This is just for demonstration purposes, because you'll be doing this on people. So here is my artery. I've got it about 2 finger breadths up above it. Of course, you've got your release valve, righty-tighty, lefty-loosey. So be sure it's tight before you pump it up. In order to find how high are you going to pump it, a lot of people say, well, we just pump it to 200. Well, what if somebody's blood pressure is 220 and you didn't pump it high enough? What if somebody's blood pressure was 90/50 and you pumped it way too high? So you can do damage to people's lymphatic systems, to their arms. You can bruise them. It hurts. So you don't want to pump it up that high. You want to know how high do you have to go. And how you determine that is you palpate your artery, and you watch your dial, and you inflate it. and I'm feeling for that pulse, and I'm still feeling it. So let's say at 140, I don't feel that brachial artery anymore. The pressure of 140 occluded it. So that means if I quit feeling the pulse at 140, I would add 30 to that. So I would pump it up to 170. That's how high I would pump up my cuff when I went to check it. So I would deflate it, let them set a few minutes, and then I would check their blood pressure. So again, you don't automatically run someone's, pump it up to 200 or 250. You need to know how high. So you fill it to the artery occludes, then you go 30 above it. Then you're listening again. Watch the video so that you can hear the Korotikoff sounds and be able to record it correctly. Now, when you're checking someone's pulse rate, we normally do a radial pulse. To check someone's radial pulse, if you look at your wrist, your radial pulse is above your thumb. When you feel someone's pulse, you want to use your index finger and your middle finger. You don't want to use your thumb because you've got a pulse in that of your own and you'll be feeling your own. So you lightly palpate. You don't want to press hard that you're occluding it. You just barely want to palpate. And to check someone's radial pulse, you've got to have a watch. I'm a bad person, I don't have one on. But you're going to count for 15 seconds, not 15. You're going to count for 30 seconds. I apologize, I was taught 15 seconds many years ago. You count for 30 seconds, and then you multiply by 2. So if I'm counting for 30 seconds, and say I get 32 beats in 30 seconds, that means their pulse rate is 64. A lot of people scramble for papers to write stuff down. But if I get 32, so 32 times 2 equals a full minute, it's going to be 64. Now let's say I'm checking that heart rate and I notice their radial pulse is irregular. So when you're checking the heart rate, you need to notice, is it a regular beat? Is the beats normal? Or is there an irregular beat to it where it's I know it's annoying when I do that, but if you notice that the patient's heart rate is abnormal or irregular, then you need to check it for a full minute at their apical site on their chest to check an apical pulse. When you check an apical pulse, you have to count for a full 60 seconds. You can't multiply it. You've got to do a full 60 seconds. And there are actually some heart medications that you have got to check an apical pulse before you can administer them. For example, Lanoxin or Digoxin, you have to check their heart rate before you give it, their apical heart rate, and if it's less than 60, you do not administer that medication. So to check someone's apical pulse, you've got to find their mid-clavicle. So find your collarbones or your clavicle. You go mid-clavicle and you go to the 5th intercostal space, which is usually right below the breast. Let's look over here on Sammy. So this is Sammy. So this here is going to be his clavicle. We're going to go 1, 2, 3, 4, 5. So we're going to listen to his mid-clavicular line, 5th intercostal, or in between the costal area, in between the ribs. So we would put our stethoscope here to listen to Sammy's intercostal, 5th intercostal space to count his apical pulse for, again, 60 seconds, 1 full minute. Okay. On respirations. With the respirations, you can't just make up a number. And I think if you've worked as a tech or something very long, you've seen nurses look at them and go, 16. You can't just make up a number. You have to actually count. And one respiration is an in and an out. And an in and an out. Now, I usually do it after I check their pulse rate. I keep my hand on their wrist like I'm still counting their wrist and I'm watching them breathe. Because if a patient knows that you're watching them breathe, all of a sudden they're doing, big respirations for you. So I'm normally pretending like I'm watching them breathe. Sometimes I even fold their arm up across their chest. That way I can feel their respirations in and out. You count for 30 seconds, multiply it times 2. So if in 30 seconds I get 8, that means their respirations are 16. You've got to be sure to do your math, because if you keep charting that someone's respirations are 8, that's bad. That means somebody's dying. So you be sure that you do your math. The same with the pulse rate. You've got to multiply it times 2. You don't want to call the doctor with a heart rate of 34 when what you meant to say was 68. That's going to be a big problem for you. So be sure you're documenting that correctly. Also with respirations, again, sometimes you can count them from the back, but you just don't need to guess. You can't eyeball something. When I do someone's respirations, I catch myself breathing when they breathe, and that helps me count better. Maybe that will help you, and that's how I do it. If you have any questions, again, I encourage you to watch that video that I've posted on D2L so you can hear the Karatkov sounds and do the exercises. So if you have any questions, let me know, and be practicing on your loved ones. That's it.